guys, welcome back to Medical Coding with Blue. Today's episode is all about basic skills that people who want to get into medical coding need. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so aside from medical terminology, anatomy, pathophysiology, I'm talking about the basic skills and communication and things like that. That's what I'm talking about today. Now, these things people don't think about, and people don't really think that they're important. They are important. And it doesn't matter, I've said this several times on my channel, it doesn't matter your age. I don't know why people think that if they're 50 years old that they are over the hill and that they can't get into this. People who are over the age of 50 get into this all the time. I have people in their 60s and some in their 70s who tell me that they are on their journey to becoming a medical coder. So don't let your age, first of all, get in your way and make you think that you can't do this, okay? If you have basic skills that I'm talking about today, and the fact that you are getting trained in medical coding and that you are going to get those foundational skills like medical terminology, anatomy, and pathophysiology, you're on your way and you're setting yourself up for success. The first thing that I want to talk about is if English is not your first language. If English is not your first language and you really want to pursue this, this is something that you have to work on. This is not a negotiable. It is not an excuse or a reason. So for people who says, well, English is not my first language and, they're just going to have to understand. These providers will not understand. They are going to look for any and every excuse not to listen to you. So if your speech is poor, if your writing is poor, that's another reason for them not to listen to you. So you have to work on that. If this is something that you really want to pursue, then you want to make sure that you are doing everything you can to set yourself up for success. And even if that means that you practice on your speech, enunciating your words, listening to videos in English, so that way, like movies and things, to kind of help you with your English and mimicking back what you hear, that's what you have to do. And there's no shame in it. That's just the way some people have to learn. But you learn by mimicking the sounds and getting your voice to be more clear and your words to be more enunciated. So that way, when you're communicating with these providers, they understand what you're saying. And that's really important. People who have a thick accent can also work on that as well. There's lots of videos on YouTube that talk about how to enunciate your words, and if English is not your first language, how to sound like a more natural speaker of English. So that's just one of those things that I'm going to suggest to you all. Now, if you are offended because I have said this, there's really nothing that I can do for you other than the fact that that's on you, that's not on me. I'm telling you how it is in the real world when you are in this industry where it's all professionals and they have lots of education. They are going to look at medical coders and they're going to look for any and every excuse not to listen. But you, again, want to make sure that you're setting them up to be able to listen to you. And that starts with having good speaking skills, right? So that's one of the first things that I will say right off the bat. Now, if you do speak English as your first language and you say, well, Blue, I don't like speaking, that's something that you're going to have to get over. As far as like speaking in front of people, speaking to new people, some people say they get very nervous, and that's understandable because it's something that's new in your life. But that's not a reason to shy away from trying to better your skills in public speaking. You can do that. You can better your skills in public speaking. So you don't have to be just chained to your fear of public speaking or fear of speaking out to other people when you can work on that. That is something that you can work on. And again, it's going to make you successful in this industry because you will be able to convey these very difficult things about coding that these providers are going to need to know because you are their teammate and you're there to help. So I did get this message from a viewer, and this message pulls in everything that I've been trying to tell you guys that it's very important. Writing skills are very crucial because if you don't have good writing skills and you're sending a query to a provider or you're trying to send them education, notes and things like that, if they don't understand what you're saying and if you're not running things through like like Grammarly or something like that, and they don't understand you, they're not going to listen to you. And again, we want to make sure that they are going to listen to us. And so this example is, again, everything that I always say is attention to detail. It's good writing skills that you have to have. This person doesn't have that. But I want to read this as an example because I need you all to understand that what you're getting into with medical coding, medical billing and coding, health information, there's lots of opportunity with this. But again, it's going to take you to bring your best and put your best foot forward, okay? So the person says, hello, dear Blue, and spelled my name wrong. And y'all know I can't stand that. And even though you say, well, Blue, it's the autocorrect. That's where you have to pay attention to detail. Because even when you're in this industry, if you transpose numbers or letters or anything, and it can actually change a bill, it can change a code, so it can make whatever you're trying to convey, this information, it can completely change it. So again, start getting used to paying attention to detail now. That's very important, okay? So that I will say first. Then they go on to say, I am a medical equipment seller, and I am interested in become a certified billing and coding guy in Miami, Florida. Do you know if this certification can be used to get a job all around US or depend of the state you are working and with 50 years old? Now, guys, I will tell you this, that if you think just because you're 50 years old that you can't get into this or this is something that you shouldn't be pursuing, there's a lot of people on my channel who are in their late 50s, early 60s, mid 60s, early 70s telling me that they're pursuing this. And I've had plenty of them come back and tell me that they followed my advice, they were able to get their first job, and they're now a medical coder. So don't think that this is something that you can't pursue because maybe you think that you're too old. You're not too old. There's a lot of people that are living longer nowadays, and they have their mind, they want to be able to do something with it, or they've had a lot of experience in their past industry and they want to keep going, and that's totally fine. It's entirely up to you. But having that hesitation just because you're getting into something and, oh, I'm 50 years old, I don't know if I can do this. 50 is still really young, okay? So that's something that you have to stop thinking about that and stop putting out those barriers that, oh, I can't do this because of this. Okay, you could do whatever it is that you want to do. And again, the other part of this is your research. This person wants to get into medical billing and coding, but doesn't know that when you sit for your certification, that it's a national certification, that you can go anywhere with it. I don't understand the people who say, oh, I'm going to sit for my state boards. It's not a state board exam, first of all. We as medical coders have a national certification that we sit for, which means that this certification is good all over the US. It's actually good all over the world, depending on where you're working, because obviously there's American outposts in different countries. So like if you're working for the government, things like that. So those are things that you have to know. You can go anywhere with your certification. It is not a state board. We are not doctors. We are not nurses. Doctors, nurses, attorneys, they all have to be state certified. They have to go through their state boards and things like that. So they have all of those things. We don't have that. We have a national certification again, and this goes back to you being able to do your research. On my channel, I've discussed it several times when it comes to the certifications and what they all mean and the breakdown. And yes, you can go anywhere with it. It's not, you're not limited to just the state that you took your exam in, okay? You can go anywhere with it. It's good everywhere. So that's just something that you have to know. But again, it goes back to being able to do your research. Research is very big in health information, medical coding, medical billing, because things update all the time. And because they update all the time, you have to know like where your resources are at. Of course, cms.gov, that's a really big resource for a lot of updates that happen in real time. So that's something that you want to get familiar with. The association websites, aapc.com or ahima.org, ahima.org. These are the medical coding and health information associations, right? The American Health Information Management Association, they are the ones who control the degrees and things like that. I mean, as far as like they have the RHIT and the RHIA. So all of that information is there on their website, along with the CCS, the CCA, or the CCSP. Now, with AAPC, that it is a for-profit organization, and they have all of the information about the CPC, and they've got all of their other credentials, which I always tell new people that when you're starting out, you only need to have one certification for the first 2 years. Don't be like these people who rack up all these credentials for no good reason. Because if you're just taking tests and you don't have experience, that just tells me, if I'm a hiring manager, that you know how to take a test. That says nothing about your ability to be able to actually apply those skills. Because I've had people who say they took the CPMA and have no idea what to do with it. And I think that's a shame, because again, if you are taking an exam, you should have competence in that subject. And if you don't have competence in that subject, you shouldn't be taking it. But there's a lot of these schools out there that push these credentials because that's their job. That's what they do, because it's a business. So you don't have to be, that doesn't have to happen to you. You don't have to be taken advantage of. Just get one certification for the first 2 years so that you can get your foot in the door and you can figure out what's going on. Then, if you want to pursue other credentials, make sure that those credentials don't overlap what you already have. The CPC with AAPC tests you on all of the subjects that are in the CPT manual. And why you think that you need to have all these other credentials, I don't know, when that CPC already tests you on that. And the more credentials you get, the more CEUs you're going to have to produce, the more expensive it gets. And for some of these credentials, you have to have certain CEUs from certain vendors who can charge whatever they want to. So again, there we go back to that, it's a business. But if you're getting into this industry and you're not doing your research, that's what's going to happen to you. People are going to take advantage of you because you don't know. And again, as long as you come in and you say, well, Blue, I'm going to check this out, I'm going to check that out, I'm going to look at the job listings, so that way I can see what they're looking for in my area and what it is that they're really after in the industry, in my section of the world. So that way you know what the employer is looking for. A lot of people will, especially new people, they will be like, well, I don't know what they're looking for. I don't know what they're looking for. And it's right in front of their face. Literally right in front of their face, especially when you're looking at the job listings. What are they looking for? Medical terminology, anatomy, pathophysiology. And a lot of these job listings also say the ability to read, write, and speak English fluently. That's what they say in the job listings. If you don't believe me, go ahead and look in the job listings, so that way you can see for yourself. But I'm telling you, this is what they're looking for. And so that's just one of the other things that you have to understand. Research is huge. And it's one of those things that you can do. But a lot of times people want things spoon-fed, hand-fed to them. And again, if you think that's just so mean for you to say, Blue, there's nothing I could do about it. Wait till you get out in the real world and you experience these providers who are going to have very little patience for, foolishness. And again, you have to be independent. You have to be able to look this stuff up. Yes, it's okay to ask questions, but make sure you have done your research first. This person did not do their research at all. And when they asked this question, and the question was on best specialties for new medical coders, why would you watch that when you have a lot of other basic questions like what credentials to get and things like that? There's plenty of those videos on my channel as well. And then the other question that they asked was another question. Is true that this profession is mostly for women? It is not mostly for women. There's a lot of women in this industry, and women are just the bulk of this industry. I don't know why. I don't know why there's not more men, but I have always encouraged men on my channel that if they want to pursue medical coding or medical billing and coding, or just being a medical biller or just being a medical coder, that to go ahead and pursue it, because we need a good balance in the industry. There's not a lot of men in this industry. It's very, very small number of men. I don't know the actual statistics, but I will say that just like nursing, long ago when nursing was mostly women, then men started to get into nursing. And why? Because sometimes when you are a patient and you don't want to have, if you're a male and you don't want to have a woman, take care of you, that's understandable. Same thing if you're a woman and you don't want to have a male take care of you. There's a woman there. So there's a lot of things when it comes to this industry that would be great to get that balance. That's why I always will encourage men to pursue the field, even though there's a lot of women. And the only way to balance that out is for more men to pursue medical coding as well. And I don't know if it's just because like it's a desk job, maybe that's what, is preventing some men from getting into this, or the fact that they don't want to work around so many women. I mean, it could be any number of things, but I wouldn't let somebody just because, it's just male dominated or it's female dominated, I wouldn't let that stop me if that's what I really wanted to pursue. Before I became a medical coder, I delivered phone books, and that was mostly male dominated. My mom and I made up about a handful of women that were in that industry. And obviously phone books are long gone now. But at the time, it was mostly men who did it. And we actually, and the women of the industry actually got the more assignments that were more specialized because it required more attention to detail, and we were just better at that, and we could take our time and we could really focus on making sure everything went right. And there's good and there's benefits to either gender in this industry. And it's the same thing like sometimes with providers. Some providers, they work better with men. Some providers work better with women. It really all depends. But to have that option available to them is going to make this industry grow a lot more, because again, there's just somebody that can be able to communicate with them the way that they need to be communicated with. And so that's just one of the things that I will say. I mean, I think men and women can do whatever it is that they want to do, but I'm just saying that as far as this industry goes, you shouldn't let it scare you off that, I'm the only male that's going to be here. And yeah, for some time, there's going to be times when you're going to be the only male, but it doesn't mean that you can't do a good job. It doesn't mean that you can't contribute to the department. It doesn't mean that there's never going to be another male in that department, or that the industry is not going to grow more. So that's just something that you have to understand, and you can't let that keep you either. I've seen some men that have watched my channel and they've said, Bleu, I'm really interested in this, but I don't think I can work around that many women. I mean, I don't blame you. I have worked around a lot of women myself, and it's not always the easiest thing, But you can't come in with preconceived notions and not really know the whole deal. Because sometimes you may be embedded in a clinic. Sometimes you may be working remotely. Sometimes you may be working around just a few people. It really all depends. So you can't just automatically think that, just because I'm a man, I'm going to be working around all these women. Again, different places have different working requirements, as far as like some are remote and some are at home, and some are doing the split schedule where they're at home and then they come in for like a week or so. And I mean, it really all depends on the area. I noticed on the East Coast and the West Coast, there's a huge like location problem, as far as like there's not a lot of space sometimes in these facilities. So sometimes they have their people working remotely. I still don't recommend for new people to work remotely, but if you're in one of those areas, there's nothing that you can do, right? And so if there's nothing that you can do, it's understandable, it's okay. But at the same time, you really do want to try to get into a place first, just so you can have that camaraderie. But again, that aside, don't let, just because the fact that, it's a lot of women, don't let that scare you off, whatever you do. Again, because sometimes men will see things in a different way than women will. And when there's good and open communication, sometimes that man can say, well, hey, what about this idea? And then all of a sudden, now we have a different way of doing things because somebody came up with a better idea. That's why you have to have diversity in any setting that you have. As long as there's competence, if you have that diversity as well, now you're really cooking because different ideas and different life experiences can really make an organization grow, and it can really help with that camaraderie and things. So at least that's just my advice anyway. But I will always advocate for people to write well, to speak well, to be able to communicate. If you have a hard time with this, if you say, well, Blue, I get very nervous and very shy talking to people, there's lots of self-help things out there. There's tons of videos on YouTube. There's tons of books in the public library. There's lots of books on Amazon or Barnes and Noble or wherever you get your books, and that are designed to help you to change how you think when you're communicating with others, to help you to become a better communicator. And again, having really good communication skills can really be a game changer in your career. But if you're always thinking about, well, this and well, that, and you're not giving yourself the opportunity, again, you can really miss out. So my whole advice for today is this. Getting into this field, you're going to be around a lot of really educated people. So that means you have to elevate your personal level of education, not just in like the school books side of the house, but also personally, and to personally develop. You know, when I first started in the industry, I was very shy as far as like speaking to providers and things. I would get very nervous. But it wasn't until after a while, and I had that one provider who told me, Blue, you're the one who knows about coding. I don't know about coding. You're the expert. I need your help. And I don't know why that was the switch in my head that was like, you know what? I do have something I could contribute to this conversation and to these people, and to help them before they leave me to go off into the big bad world and to be, you know, their own boss or to work, you know, as part of a group or whatever. I can help them become very well trained in coding because this is what I know. This is my field. This is what I understand. And it's not the easiest thing to comprehend and understand all the time. And especially when their job as healthcare providers is to take care of patients. They don't have time to sit here and think about all these rules for coding and things like that. That's why I'm there as their teammate to help them. And this is what you become is as this person to help them. You know, if you are one of those people who just plain refuses to speak to providers, that's not a good thing, because they need your expertise. They need your help. Even though sometimes they bluster and they'll be saying, well, you know, they know all these things, or, you know, they're not listening to you. You can't let that run you off, because if you do, you know, it's just going to be so easy for anyone else to run you off. And then you're not going to be able to ever share your gift. And for me, I am a very stubborn person. I will give myself that. I am very stubborn. But especially when it comes to something as important as this. I've had providers who have gotten upset with me, don't want to listen to me, and I've tried different methods to be able to communicate with them. And some of those providers were very stubborn as well. So you have two stubborn people, and it's not until they see something that I've done to kind of help somebody else, or they see that they're able to be better because of their good coder, then they start changing their tune. So sometimes it just takes somebody else on the outside to kind of help you too. It really all depends. But that aside, because I don't want to stray too much from the topic, I can't get there if I wasn't a good communicator, if I wasn't always pushing myself to be a better version of me, right? Because obviously I'm a lot more outgoing than I was when I very first started. And if you're very shy right now, that's okay. Being in this and getting more confident with your coding will change you, and it will help you to become more engaged with other people, because you're going to have something that you really enjoy if you allow yourself to enjoy it. I'm just saying. But yes, make sure that you're always writing well. Practice on your writing. I don't want to hear anybody say that I don't like to write. I don't want to hear it. I don't want to hear it, because it's so important in what we do as coders. And if you are telling a provider about their documentation, then your writing needs to be just as good, okay? Your writing needs to be detailed. It needs to be accurate. It needs to be correct. Make sure that you're spelling names correctly. And I tell y'all this about my name, and people don't understand. But you go and you misspell a provider's name, and let's see what happens. It's not going to be a good day, okay? If you misspell a provider's name, a lot of providers will get very upset about that. And I don't blame them, okay? Because again, you're the person who's taking care of their coding. You better be accurate with what you're writing and what you're trying to convey. I'm just saying. But with that said, these are basic skills, guys. Reading comprehension. And I've had people ask me if reading is a big thing in coding. Yes, it is. And then some people will get upset about, like, well, what about the phone? Do I have to get on the phone? This has nothing to do with the phone. I don't care if you can answer multiple phone lines. I don't care. That's not what we do. It's very rare that we actually get on the phone with providers, okay? Unless, you know, it's part of what you do. For me, I'm embedded in my clinic. So my providers can always come knock on my door. Do some of them pick up the phone and call me? Absolutely. And we have a conversation. But it's not a big deal because they can see me. And they can see me whenever they want to. And again, it's not a big deal to be on the phone, okay? So that's just one of those things that if you're thinking about that too much, you're worried about the wrong thing. I'm just saying. But with that said, you can always work on your reading comprehension by actually reading books. Read fiction books if you need to. But I will always recommend reading the coding guidelines, because your coding guidelines is going to help you to better understand the coding itself. But reading fiction books will actually help you with your words and your word selections and your word choices and things like that. That can be a big part of your own personal education. Watch self-help videos on YouTube. That would be really great, especially if you get very nervous. Work on your handshake. A strong handshake is a very important thing, especially if you have to go in an interview. Don't ever do this stupid little dead fish handshake. I can't stand a dead fish handshake. You have to be strong, and it has to be firm, not break the other person's hand, not overthink it, but be firm and shake that person's hand, look them in the eye. Those things are important. Again, it's that good communication that you're going to be able to convey with that. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.